A 12-year-old boy infected with the Nipah virus died in Kozhikode on Sunday morning. The re-emergence of the Nipah virus in Kerala poses a fresh risk in the state. Kerala is already struggling with the Covid-19 pandemic, contributing about 60% of all new cases in the country these days. Will the outbreak remain largely localized?
Nipah virus is a zoonotic virus. And what do we mean by zoonotic viruses? These are viruses which jump from animals to human beings. So the first level of spread tends to be from animals to human being. And when it tends to occur in that manner, the numbers tend to be pretty small. Now this is a paramyxi virus. But this virus, when it jumps, it may jump from bats to human beings, or as was seen in Malaysia, it also jumps from other animals like pigs to human beings, right? And essentially, when it jumps, as I said earlier, it could be from animal to human being, but human to human spread is also possible, because all those who are taking care of this individual may also get infected, and the source then becomes the index case. It spreads while you come in contact with secretions of a person or an animal that is infected by this particular virus. Now, if it is bat, most often what has been seen, as you saw in the case of Bangladesh, as you saw in the case of Kerala, it's generally the orchards, the date palm saps, or any fruit, which could be a mango, to which these fruit bats tend to get attracted to. They tend to come and try to eat that particular fruit, and it may also pass urine or stools over it, but we will not be able to recognize that this particular fruit could be contaminated by Nipah.
Kerala had no past experience of handling an outbreak of that sort in 2018 when state reported a Nipah virus. The state then followed the protocol of Ebola virus, which had been reported mainly in African nations. The state had a clear-cut strategy in 2018, which comprised contact tracing, isolating the persons, particularly all those who had direct or indirect contact with the suspected Nipah cases. At one time, around 3,000 people have been quarantined in Kozhikode and nearby Malappuram districts, which had reported the Nipah virus. Since COVID protocols are already in place, there is a better awareness about transmission of the viral diseases. Hospital staff and healthcare workers are very careful about handling all patients, particularly those who turn up with fever symptoms. They use PPE kits, gloves and masks while handling all type of patients at the hospital. One of the main reasons for a relatively quick end to an outbreak of Nipah is the fact that the virus is far less infective than coronavirus. For example, human-to-human transmission is not as easy or as fast as we have seen in the case of COVID.
It is extremely critical that we should identify the source of infection even in the current episode as to how the 12-year-old boy got infected by Nipah. This helps you in understanding who could be the close contacts of that person who currently may be unknown, or what is the animal source from whom this 12-year-old boy got it. These would have implications in controlling this particular outbreak, because then you can isolate all those who were close contacts so that it doesn't spread across in the community.